If you've been finding more hair in your hairbrush, more strands on your pillow, or more scalp showing through when you look in the mirror, and you've been telling yourself, well, this is just aging, I need to stop you right there. Hair thinning after 60 is not aging, it's a receptor problem. Specifically, the vitamin D receptors inside your hair follicles. And what most people don't realize is that this problem starts decades before you see the result in the mirror. By the time you notice the thinning, the receptors have already been quietly failing for years. Today, I'm going to walk you through exactly what's happening at the follicle level, why standard hair products won't fix it, the one blood test you need to ask your doctor about, and a simple daily protocol that may help support healthy hair growth, all without spending $1 on the miracle hair growth ads you've probably seen. Stay with me. By minute 14, I'll show you something most people have never heard before about how vitamin D actually controls the hair cycle. I'm Dr. Ravtani, family physician. And I'll be honest with you, when patients over 60 come to me about hair thinning, most of them have already accepted it as inevitable. They've already bought the shampoos. They've already tried the biotin gummies. They've already been told by someone that this just happens with age. And they're wrong. Not entirely. Yes. Hair changes with age, but there's a specific mechanism behind senior hair thinning that almost nobody is talking about, and once you understand it, everything else makes sense. This is the conversation your doctor probably hasn't had time to have with you. Quick but important, this video is educational. If you're experiencing rapid hair loss in patches, hair loss with scalp pain or rashes, or hair loss along with other symptoms like weight changes, please see your doctor. Some causes of hair loss need medical investigation, not just nutritional support. Use this video as a starting point for a conversation with your physician. Before we go deeper, type thinning in the comments if you've noticed your hair changing in the last 2 years. I read every reply. You're not alone in this. Let me show you exactly what's going on inside your scalp right now. Your hair grows in a cycle. Every single hair on your head goes through 3 phases. The first phase is called anagen. This is the growth phase. The hair is actively being built. Anagen lasts anywhere from 2 to 7 years for most people. The longer your anagen phase, the longer your hair can grow. This is why some people can grow hair to their waist, and others can never grow hair past their shoulders. It's not about hair products. It's about how long their anagen lasts. The second phase is called catagen. This is a transition phase. The follicle stops actively building hair. This phase lasts only 2 to 3 weeks. The third phase is called telogen. This is the resting phase. The hair sits in the follicle, no longer growing, slowly preparing to fall out. Telogen lasts about 3 months. At the end of telogen, the hair sheds, and the follicle goes back to anagen, starts growing a new hair. This is how hair cycles, constantly. Every follicle, on its own schedule. Now here's the part most people don't know. Every single hair follicle on your body has vitamin D receptors built into it. These receptors are located in a specific region of the follicle called the outer root sheath, and they are not optional. They are not decorative. They are functional. These receptors do one critical job. They receive the signal that tells the follicle when to transition from telogen, the resting phase, back to anagen, the growth phase. In simple words, vitamin D receptors are the start growing again switch. If those receptors don't get the right signal, the follicle stays in telogen too long, the hair stays in resting phase, new growth doesn't start on time, the hair sheds, but nothing replaces it. Over time, you have fewer hairs in active growth at any given moment. The total volume drops. The scalp shows through. That's what hair thinning actually is, not aging, not genetics alone. It's a failure of the signal between vitamin D and the follicle receptors. This is why most hair products fail. They're treating the surface, the hair shaft. But the problem isn't on the surface. The problem is in the receptors deep inside the follicle. So why does this fail more after age 60? 3 things stack up at the same time. The first is skin synthesis decline. Your skin makes vitamin D when it's exposed to sunlight. But after age 60, your skin produces dramatically less vitamin D from the same amount of sun. By age 70, the production capacity has dropped by about 75% compared to a 20-year-old. The second is kidney function decline. Your kidneys play a key role in converting vitamin D into its active form. After 60, kidney filtration slowly declines, this is normal aging, and the conversion becomes less efficient. So even when vitamin D is coming in, less of it gets activated. The third is receptor sensitivity. The follicle's vitamin D receptors themselves become less responsive over time. They need higher levels of vitamin D circulating in the blood to trigger the same response they used to trigger easily. So you have less vitamin D being made, less of it being activated, and the receptors needing more of it to respond. 3 layers stacking on top of each other, and the result shows up in the mirror as gradual thinning. This is why your hair started changing in your 60s when it was fine in your 50s. Nothing dramatic happened. Just 3 slow declines combining at the same time. A study published in the journal Skin Pharmacology and Physiology documented this connection between vitamin D status and various forms of hair loss in adults, particularly in older populations. The Endocrine Society has noted vitamin D's role in hair follicle cycling in its clinical guidance. This isn't fringe. This is documented science. It's just not part of the standard conversation about senior hair changes. Let me give you an analogy I use with patients. Imagine your hair follicle is a small factory. The factory makes hair. The factory has a manager who decides when to start production and when to pause production. The manager receives instructions from headquarters by radio signal. When you're young, the radio signal is strong. The manager hears it clearly. Production starts and stops on schedule. The factory produces consistent output. After 60, 3 things happen. The headquarters sends a weaker signal, less vitamin D made. The signal gets distorted on the way, less activation. The factory's radio becomes less sensitive, less responsive receptors. The manager still hears something, but not clearly. Sometimes the start production message comes through. Sometimes it doesn't. Production becomes erratic. Some shifts the factory makes hair normally. Other shifts the factory just sits idle, waiting for a signal that never quite arrives. Multiply this across the 100,000 follicles on your head, and over months and years, the result is visible. Less hair being produced at any given time. Total volume slowly drops. The hair products you see advertised, they're trying to repair the products coming out of the factory. They're trying to make the existing hair look thicker. None of that addresses the radio signal problem. The factory is still producing too little. To actually support hair regrowth, you need to fix the signal, not the surface. Quick check. When you brush your hair, do you see more strands in the brush than you did 5 years ago? Type yes or no in the comments. I want to see how widespread this is. The blood test you need to ask for. If anything I've said so far resonates with you, here's the first action step. Ask your doctor for a blood test called 25-hydroxyvitamin D. It's sometimes written as 25-OH-D. This is the storage form of vitamin D in your body, and it's the standard test that tells you whether you have enough. This test is not part of every routine blood panel. You usually have to specifically request it. The cost is typically $30 to $50 in the United States. Many insurance plans cover it when ordered for cause. Now let me explain what the numbers mean, because this matters. Below 20 nanograms per milliliter is considered deficient. This is the level at which active treatment is typically warranted. Between 20 and 30 is considered insufficient by many guidelines. Some patients are symptomatic in this range. They have the hair issues we're discussing, the fatigue, the mood changes. 30 to 50 is considered adequate by most guidelines. Some longevity-focused physicians aim for the higher end of adequate, 40 to 60 nanograms per milliliter, particularly for patients with hair-related concerns. This is debated in the medical community. Work with your doctor on the right target for your specific situation. But here's the part that surprises most patients. Vitamin D levels alone aren't the whole story. The receptors also need to be functioning. And receptor function depends on something called vitamin D receptor sensitivity, which is influenced by genetics, by inflammation in the body, and by certain nutrient cofactors. The most important cofactor is magnesium. Vitamin D cannot be properly activated and used by your cells without adequate magnesium. Many older adults are mildly low in magnesium. Without enough magnesium, you can have technically adequate vitamin D levels and still have follicle receptors that aren't responding properly. The second cofactor is vitamin K2. K2 helps direct calcium to the bones and away from soft tissues, but it also supports the broader signaling system that vitamin D operates in. So when you talk to your doctor about hair changes, the conversation isn't just, "Let me check your vitamin D." The fuller conversation is, "I've noticed hair thinning. Could we test my 25-hydroxyvitamin D? And could we also discuss whether I'm getting enough magnesium and whether other nutritional factors might be involved?" That's a smarter question. That's the question that opens up the right investigation. The protocol, what you can actually do. Let me give you the practical protocol. This is what I'd suggest discussing with your doctor. Step 1. Get tested. Don't skip this. Don't guess. Get the 25-hydroxyvitamin D blood test done. Know your number. Without the number, everything else is guessing. Step 2. Build the foundation through food first. Your body is designed to get vitamin D from sunlight and from food. Before adding supplements, optimize what you're eating. Foods that provide vitamin D: fatty fish, salmon, mackerel, sardines. These are the strongest food sources. 2 to 3 servings per week makes a meaningful difference. Egg yolks. The yolk specifically, vitamin D lives in the fat. About 40 IU per yolk. Fortified milk and fortified plant milks. Check the label. Fortification varies. Cod liver oil. Traditional source. Strong and effective. Talk to your doctor first. Foods that provide magnesium: leafy greens, spinach, kale, Swiss chard, almonds, cashews, pumpkin seeds, dark chocolate, 70% cacao or higher avocado, black beans, edamame. For most older adults, building these foods into the regular diet, 3 to 5 servings of dark leafy greens per week, 2 to 3 servings of fatty fish per week, a handful of nuts most days, creates the foundation that supplements will then build on top of. Step 3. Sunlight exposure, when safe. 10 to 30 minutes of midday sun on bare arms and face, 2 to 4 times per week, supports skin synthesis. This depends on your skin type, your latitude, and your skin cancer risk. Talk to your doctor and dermatologist about what's right for your situation. For many seniors in northern latitudes during winter, sunlight alone isn't enough. That's where supplementation becomes part of the conversation. Step 4. Supplementation. Only with guidance. This is the step I want you to be careful with. Vitamin D supplements are available everywhere. They're cheap. They seem harmless. But getting the dose wrong matters. Too little supplement won't bring your levels up. Too much can cause problems, particularly if you have kidney issues, certain heart conditions, or you're on medications like thiazide diuretics. The right dose depends on your starting level. Someone who tests at 15 might need a higher loading dose for a few weeks than a maintenance dose. Someone at 25 might need a lower steady dose. Someone at 40 might not need any. This is exactly why I keep saying, get tested first. Then talk to your doctor about dose. Then recheck levels in 3 to 6 months to see how you're responding. The same applies to magnesium. Many seniors benefit from a magnesium supplement. But if you have kidney disease or you're on potassium-sparing diuretics, magnesium supplementation needs medical guidance. Step 5. Patience. Here's the part nobody tells you. Hair follicle cycles are slow. If your vitamin D was low for years, fixing it doesn't reverse the hair changes overnight. The follicles need to go through their cycles, telogen, then back to anagen, and rebuild density gradually. Realistic time frame to notice changes: 3 months, shedding may slow. 6 months, new growth may start becoming visible. 12 months, meaningful density changes possible. Anyone promising you regrow your hair in 30 days is selling you something. The biology doesn't work that fast. But over 6 to 12 months, with the underlying signaling restored, many patients do see meaningful improvement. If you're still with me past minute 14, type "with you" in the comments. This part of the video is where most people leave, and you stayed. I want to know who you are. The one thing most people don't know, 14, 17 Sao. Here's the part I promised you at the start. Most people think vitamin D works on hair by being a vitamin, something the body needs in small amounts. That framing is wrong. Vitamin D doesn't act like a vitamin, it acts like a hormone. The difference matters. Vitamins typically participate in chemical reactions. They're consumed in the process. Hormones, on the other hand, send signals. They bind to receptors. They turn genes on and off. When vitamin D binds to a receptor inside your hair follicle, it doesn't get consumed. It triggers a signaling cascade. That cascade activates specific genes inside the follicle cells. Those genes produce the proteins needed to start a new growth cycle. In other words, vitamin D turns on the genes that start hair growth. When vitamin D is low, those genes are less likely to be activated on schedule. The follicle stays quiet. No new growth. This is why simply applying vitamin D to your scalp topically doesn't fix the issue. The vitamin D needs to be present systemically, in your bloodstream, and it needs to bind to the receptors in the right way, with the right cofactors present. This is also why hair-specific shampoos and serums can't address the root problem. They're applied to the surface. The signaling happens deep inside the follicle. And this is why correcting vitamin D status, when it's actually deficient, often shows up in places beyond just hair. Patients who fix their vitamin D commonly report better sleep, more stable mood, less fatigue, better immune function, and yes, gradual hair improvement. Because the same receptor system operates throughout the body. You're not just fixing hair, you're fixing the signal across multiple tissues at once. That's the bigger picture nobody talks about. Hair is just the most visible sign of a deeper systemic issue. What to do if you're not sure where to start? If everything I've said feels overwhelming, here's the simplest possible starting point. This week, do 3 things. 1. Schedule a doctor's appointment. If you haven't seen your physician in the last year, schedule a routine visit. When you go, mention the hair changes specifically. Ask, could we include 25-hydroxyvitamin D in my blood work? I've been noticing hair changes and I'd like to understand if vitamin D could be a factor. That's it. That single sentence opens up the whole investigation. 2. Add 1 vitamin D-rich food to your weekly rotation. Not a major overhaul, not a complete diet change. 1 addition. Salmon for dinner once a week. 2 eggs at breakfast a few times a week. A small piece of dark chocolate after dinner. Pick 1. Small, consistent changes compound over months. 3. Get 10 minutes of midday sun on bare arms 2 or 3 times this week. If weather allows. If your skin tolerates it. If your doctor hasn't told you to avoid sun exposure. Just 10 minutes. 2 or 3 days. This week. 3 small steps. None require buying anything. None require permission. All of them start moving you in the right direction. If your blood work comes back showing deficiency, you and your doctor can then have the more detailed conversation about supplementation, dosing, and monitoring. That's not a conversation you have alone. That's a partnership. And if your blood work comes back showing your vitamin D is fine, then we look elsewhere. Thyroid function, iron levels, certain medications that affect hair. The hair thinning may have a different cause. That's also useful information. It tells you where to investigate next. Either way, you've moved from "I'm just getting older" to "I have actual information about what's happening in my body." That's a meaningful shift. The closing, I want to leave you with a thought. The phrase, "this is just aging," has become a way to dismiss symptoms in older adults. Tired, just aging. Achy, just aging. Hair thinning, just aging. But aging itself is a process, and processes have mechanisms. Mechanisms can be understood. Mechanisms can sometimes be supported. Hair thinning after 60 is not a simple aging verdict. It's the visible result of a specific signaling failure between vitamin D and the receptors inside your hair follicles. That failure has identifiable causes. Those causes have practical interventions. Those interventions, when applied consistently and with medical guidance, can support your body's own ability to maintain healthier hair growth. You don't have to accept the verdict. You can investigate, you can test, you can adjust, and you can give your follicles the right signals over time. If you walk away from this video remembering only one thing, let it be this. Ask your doctor for the 25-hydroxyvitamin D blood test. Just that one test, once. The information you get from that single, inexpensive test will change how you and your doctor think about not just your hair, but your fatigue, your mood, your immunity, your bones, your skin, all at the same time. That's the power of looking at the underlying mechanism instead of just treating the surface. If this video helped you, please consider hitting the like button. It signals to YouTube that this kind of content is useful and it shows the video to more people who need to hear it. Subscribing to the channel. New videos every Tuesday and Friday at 6 a.m. Eastern, covering topics most seniors don't get explained clearly. Sharing this video with anyone you know who's been noticing hair changes and accepting it as inevitable. They deserve to know there's an investigation worth doing. Take care of yourself. Get the test. Have the conversation. Your body deserves the answers. I'll see you in the next video.